Hi, I'm Dr. Steve Krager, and I'm the Deputy Health Officer for Clark, Cowlitz, Skamania, Pacific, Lewis, and Wahkiakum counties in Southwest Washington. Today I want to talk about Omicron. First, I want to acknowledge that everyone is tired. Tired of the pandemic, tired of new variants, tired of uncertainty. But COVID-19 is tireless and unfortunately not done with us yet. However, we have made great progress since the last holiday season, and we can take relatively simple steps to stay safe during this holiday season. So let's talk about Omicron. We're going to hear a lot more about this variant over the next few weeks. I want to make sure we're all on the same page. I want to talk about what we know and what we don't know. So Omicron is a new variant of the virus that causes COVID-19. So many variants have come and gone over time as the virus mutates. And most recently, nearly 100% of the cases in the US and in Washington state were due to the Delta variant. But this is rapidly changing with Omicron. We are going to see a lot of Omicron cases in Washington in the next few weeks, leading to really high COVID-19 rates. And we know this because that's what's happening in other parts of the world where Omicron established itself earlier. So what else do we know? First, let's talk about some good news. The vaccines are performing really well against preventing severe disease. Being fully vaccinated is providing protection from hospitalization and death, and this protection is even better if you're boosted. And protection from any type of infection is still estimated to be up to 80% if you're boosted. One point on boosters I want to make. The early data we have now is that the Pfizer and Moderna COVID-19 vaccines are working better against both Delta and Omicron, both as an original vaccine and as a booster. So if you had J&J first, I'd recommend you consider one of those vaccines for your booster. Another piece of good news. All the tests we have now will still tell you if you have COVID-19, even if it happens to be the Omicron variant. Now, most tests don't get sent for the genetic sequencing that confirms Omicron, but if Omicron starts becoming, 100% of cases, as it looks like that's going to happen, all our COVID-19 tests are still going to work. People who've been infected in the past with COVID-19 also seem to have some protection from severe disease, although that protection is improved if they're also vaccinated. So what about the bad news? Omicron is up to 3 times more contagious than Delta. That is leading to rapid spread across the world, including the United States and Washington. The University of Washington Virology Lab estimates that over 70% of the current samples they are testing are the Omicron variant, which means Omicron is the dominant variant and will remain that way for the time being. Omicron is much better at causing reinfection than any past variant. This means if you've had COVID-19 in the past, even very recently, you may not be well protected against infection with the Omicron variant. It's also better at causing breakthrough cases, so infections in people who are fully vaccinated, especially compared with past variants. Although I would note, again, you seem to be well protected from severe disease and illness if you're vaccinated. So what do we need to learn more about? We do not have a clear understanding of how much severe disease Omicron causes, especially among people who have no immunity to COVID-19 at all. There have been reports that suggest that Omicron may cause milder disease in general. However, we're very early, and that is yet to be confirmed absolutely. Even if Omicron on average causes less severe disease, that doesn't mean severe disease won't happen at all. So maybe instead of 2 out of 100 people being hospitalized, it's 1 out of 100. But if 10 times as many people get infected, that's still 5 times as many hospitalizations. So what can we do about this, especially in the middle of the holiday season? So it's never too late to get vaccinated. The best time to start your vaccinations or get your booster is now. If you're having a get-together, have everyone take a self-test if that's available. Those are probably the most convenient way to test. You can also go to other places for testing. I know they're hard to come by, but they can really help. If you test positive, whether you have symptoms or not, believe it and isolate away from others for 10 days. If you're negative, the chance of you infecting someone else is really low. If you're at a busy gathering, you can open windows for fresh air. You can use air purifiers. Both those can help with air quality. If you're in a really crowded indoor setting, wear a mask and make sure it has multiple layers and fits well. And just take extra care for the high-risk people in your life. So whether that's someone who's unvaccinated and high risk, someone who is especially vulnerable, I just want us to be considerate about how our decisions impact them. Thank you for listening. I hope that answers some questions about Omicron. We will get through this. I hope you have a great holiday season and be kind to one another.